Imagine this, a disease costing an industry like billions every year. But here's the thing, most animals carrying it. They look perfectly fine, it's often invisible, sort of a silent drain, but the impact is massive. Welcome to the deep dive. Today, we're diving into bovine lymphoma, sometimes called bovine leukosis. It's a neoplastic disease, basically, cancer affecting cattle all over the world. We've gone through a whole stack of sources on this, and what we want to do is unpack the different types, what causes them, how they spread, sometimes pretty sneakily, the really surprising economic cost, and how farmers are trying to get a handle on it. Our mission really is to give you a clear picture of what's actually a pretty complex animal health problem. And, as we get into it, you'll see there's this huge difference between the two main types. One's caused by a virus, a really interesting path it takes, and the other, still a medical mystery. And that difference, it changes everything about how you manage it. It's key. So let's start big picture. What is bovine lymphoma, essentially?
Well, at its core, like you said, it's neoplastic,
Yeah.
abnormal tissue growth. And it mainly hits the lymphatic system in cattle, leading to tumors.
Okay.
And it splits into two main kinds: enzootic bovine leukosis, EBL, and sporadic bovine leukosis, SBL.
Right, EBL and SBL. And you mentioned that key difference. One has a known cause, right, and the other doesn't.
Exactly. That's the fundamental split, and it's so critical. EBL is directly caused by a specific virus, the Bovine Leukemia Virus, BLV.
Ah, okay, BLV.
So when you know the culprit,
Yeah.
like BLV, you can target it. You can focus control on stopping transmission.
Makes sense.
But with SBL, sporadic bovine leukosis, well, the cause is largely unknown. We just don't know what triggers it.
So prevention gets really tricky.
Inherently limited, yeah.
Mhm.
Management often shifts to just dealing with symptoms, maybe removing the sick animals. It's like fighting a known enemy versus chasing a ghost.
Okay, fighting a known enemy. Let's tackle that first then. EBL, caused by the Bovine Leukemia Virus, BLV. Our sources call it an oncogenic retrovirus. That sounds intense. What does that actually mean for the cow?
It does sound a bit sci-fi, doesn't it? But understanding it's key. Oncogenic just means it can cause tumors, cancer.
Okay.
And retrovirus refers to how it works. It's clever in a way. It takes its own genetic material, RNA, and converts it into DNA.
Mm-hmm.
Then, this new DNA, called a provirus, slots itself right into the host cell's own DNA, its genome.
Wow, it becomes part of the animal's blueprint.
Exactly. It integrates. And that's why once an animal's infected with BLV, it's infected for life. The virus is literally woven into its genetic makeup.
So no cure for the infection itself.
No known cure.
Ah.
And that fact shapes everything. Control has to be about preventing new infections, not trying to treat existing ones.
Right. If it's permanent, you absolutely have to stop it spreading. How does it actually move between animals? Is it just one way or?
It's definitely multifaceted. Prevention is the name of the game.
Mm-hmm.
BLV mainly spreads through transferring blood or blood products that have infected lymphocytes.
Mm-hmm.
Those are white blood cells.
Okay, fine.
And the routes are, well, both horizontal animal to animal or through the environment, and vertical, so mother to calf.
Okay, let's break down horizontal first. What kind of things transfer blood? The sources mentioned needles, dehorning tools.
Yeah, a whole range. Contaminated beetles are a big one. Dehorning or castration equipment if it's not cleaned properly. Tattooing pliers, ear taggers, hoof knives, even those nose tongs sometimes used.
Wow, lots of routine stuff.
Exactly. And what's really striking is the role of iatrogenic spread. That means spread caused by us, by human activity during farm work or vet procedures.
So things like reusing needles.
Reusing needles, not disinfecting instruments thoroughly between animals. These are often the main drivers of horizontal spread. It means super strict biosecurity isn't just a nice to have, it's essential. Single-use needles. Meticulous disinfection, it's critical.
That's a huge point. What about other ways, like insects or just being near each other?
Yeah, biting insects like horseflies, tabanids, they can act as mechanical vectors. They bite an infected cow, get blood on their mouth parts, then bite another cow. Transfers the virus.
Ugh.
Direct contact through nasal or eye secretions might play a small role too, but blood is definitely the main vehicle for horizontal spread.
Okay, so human practices are key drivers. What about that vertical route, mother to calf? How common is that?
It happens. In utero transmission, while the calf's developing, affects maybe 5 to 10% of calves born to infected dams.
So not the majority, but still significant.
Right. And then there's transmission through colostrum or milk. This one's a bit tricky.
How so?
Because colostrum, that first milk, is vital. It has antibodies the calf desperately needs. But if the mother is BLV positive, the colostrum can also contain the virus.
Oh, so it's good and bad at the same time.
Kinda, yeah. It creates a dilemma. So Strategies get specific, like feeding frozen colostrum.
Freezing it helps.
Apparently, freezing can destroy the virus cells while keeping the antibodies intact. Or, the simpler way is just using colostrum from cows, or BLV negative.
Got it. Okay, this next bit from the sources really stood out to me. Most cattle infected with BLV, they look fine, asymptomatic carriers.
That's the really insidious part of BLV. It's like that iceberg analogy, most of the problem is hidden.
So what happens inside these seemingly healthy cows?
A big chunk of them, maybe 30% up to 70%, develop something called persistent lymphocytosis, PL.
Persistent lymphocytosis, PL. Okay.
It means they have a consistently high number of lymphocytes, those white blood cells, circulating, but crucially, no obvious signs of sickness.
But it's not harmless, right? Even if they look okay.
Far from it. PL is directly linked to immunosuppression. Their immune system isn't working at full strength.
So they're more vulnerable to other things.
Exactly. More likely to get mastitis or diarrhea, pneumonia, and there are measurable production losses too, even without visible illness. This subclinical effect is where a lot of the economic damage happens, way before any actual cancer shows up.
That makes sense. So only a few actually get the tumors.
It's a very small percentage, thankfully. Maybe 0.1% to 5% of infected cattle. And it usually happens when they're older, typically between 4 and 8 years old.
Yeah.
That's when they might develop the malignant lymphomas or lymphosarcomas.
And when those tumors do develop, the signs sound like they could be almost anything.
They're incredibly varied, yeah. It totally depends on which organ the tumor decides to grow in or around.
Right.
Well, you might feel enlarged lymph nodes under the skin, or it could affect the bomorphism. That's one of the stomach compartments causing digestive issues. Or the heart, the spinal cord, the uterus.
Wow.
General signs are often just weight loss, poor appetite, maybe low milk production. But you can get really specific weird signs too, like exophthalmia, bulging eyes if tumors grow behind the eye socket, or posterior paresis weakness or paralysis in the back legs if the tumor compresses the spinal cord. It really can mimic a lot of other diseases.
A chameleon, truly. And connecting this back, you mentioned the economic impact, billions. How does that break down if most aren't getting sick?
It's staggering, isn't it? Estimated in the billions annually just in the U.S. And like we discussed, it's not primarily from the relatively few cows that get full-blown lymphosarcoma.
It's the hidden stuff.
It's the insidious subclinical effects in those asymptomatic carriers. The reduced milk yield day after day, the cows not lasting as long in the herd, needing replacement sooner, compromised fertility. All these things add up across millions of animals.
And the prevalence numbers are shocking. You said, what, 89% of U.S. dairy herds have it?
Around 89% of dairy herds, yeah, and about 38% of beef herds, and that beef number seems to be climbing. It's incredibly widespread, often silently chipping away at productivity.
Okay, let's pivot now. Away from BLV and EBL to the other side. Sporadic bovine leukosis, SBL, this is the one you said isn't linked to BLV, cause unknown. That sounds like a totally different ballgame for trying to control it.
It absolutely is a different challenge. No known cause means, well, no specific target for prevention. It's baffling, honestly.
So what do we know about SBL? Does it look the same as EBL?
It actually presents in 3 quite distinct forms, and they're strongly linked to the age of the animal. It's very different from EBL.
Okay, 3 forms. What are they?
First is the juvenile multicentric lymphoma. This hits very young calves, usually under 6 months old, often around 3 or 4 months.
Young calves. What does it look like?
It's aggressive, massive, generalized swelling of lymph nodes all over the body. The calf gets severely ill very quickly, and it's usually fatal within just a few weeks. Very rapid.
Wow, that's rough. What's the second form?
That's thymic lymphoma. This affects slightly older cattle, typically between 6 months and 2 years old.
Thymic. So involving the thymus gland in the chest.
Exactly. It's characterized by a large tumor mass growing in the mediastinum, the chest cavity, often involving the thymus. This leads to signs like swelling in the neck or brisket, difficulty breathing, dyspnea, and often chronic bloat because the mass presses on the esophagus.
Okay, chest mass. And the third?
The third is cutaneous lymphoma. Cutaneous meaning skin. This usually affects cattle between 1 and 3 years old.
So skin lumps.
Yeah, it presents as distinct nodules or plaques in the skin, often on the neck, back, rump, thighs. They can be quite noticeable.
And the prognosis for this skin form, is it as bad as the juvenile one?
Actually, this one's interesting. Cutaneous lymphoma can sometimes undergo spontaneous remission. The lumps might just disappear on their own.
Oh, really?
Yeah.
Yeah.
But it can also relapse later. And sometimes it progresses, moving from the skin to involve internal organs.
Ah.
And if that happens, clinically, it can become pretty much indistinguishable from EBL, except, for the animal's age and the fact that it will test negative for BLV.
So, very different outcomes. Juvenile is rapidly fatal, thymic causes serious problems from the mass, and cutaneous, well, it's unpredictable. Might go away, might come back worse. Needs watching.
Exactly. Long-term monitoring is definitely needed for those cutaneous cases.
Okay, so whether it's EBL mimicking lots of things or these distinct SBL forms, diagnosis sounds like a real challenge. How do vets actually pin it down, especially differentiating it from other common illnesses?
That's a huge part of it. The symptoms overlap significantly with other diseases. You mentioned things like weight loss, fever, anemia, maybe jaundice.
Right, sounds like it could be anaplasmosis or babesiosis, so it's tick-borne diseases.
Precisely. Those are major differentials. All can cause similar signs. So you need distinguishing features. For instance, babesiosis often causes hemoglobinuria, red urine, while anaplasmosis typically doesn't. That's one clue.
Okay.
But for lymphoma, the key finding, if present, is often those palpably enlarged lymph nodes or finding an actual tumor mass somewhere during the physical exam that points away from simple pig fever.
So a thorough hands-on exam is critical.
Absolutely paramount. Combined with targeted lab tests. You can't just rely on symptoms alone.
So for EBL, what are the go-to lab tests to confirm the BLV infection part?
The main tools are serology, looking for antibodies, and molecular tests, like PCR, looking for the virus's DNA.
ELISA is common for antibodies.
Yes, ELISA is the workhorse. It's very common, reliable for finding antibodies to BLV in adult cattle. Great for herd screening, finding those carriers. It's sensitive, specific.
And PCR, when would you use that?
PCR detects the actual BLV proviral DNA that gets integrated into the host cell. It's also sensitive and specific. Its advantage comes in younger calves, say 4 to 8 months old,
Why younger calves specifically?
because they might still have maternal antibodies from their dam's colostrum. Those antibodies could make an ELISA test positive, even if the calf isn't truly infected itself. PCR cuts through that ambiguity by looking directly for the virus's genetic material.
Ah, okay. So ELISA for general screening, PCR for specific cases like young calves. Makes sense. But you made this point earlier, and it seems really important. Finding BLV, whether with ELISA or PCR, doesn't automatically mean the animal has cancer, the lymphosarcoma.
Exactly. That's the crucial distinction people need to grasp. A positive BLV test confirms infection with the virus. It does not confirm the presence of lymphosarcoma.
So how do you confirm the actual cancer, whether it's EBL-driven or one of the SBL forms?
For that, you need pathology. You need to look at the cells or tissues themselves.
Like a biopsy.
Yes. Cytology is one way, sticking a fine needle into an enlarged lymph node, sucking out some cells and looking at them under a microscope. Or histopathology, which is examining a tissue sample, either from a biopsy on a live animal or, more commonly during a postmortem examination, a necropsy.
Okay, so looking at the actual tumor cells.
Correct. And this leads to that critical aha moment, or maybe the two-prong approach, as the sources call it. To definitively diagnose EBL-associated lymphosarcoma, you need both pieces of evidence. Yes. You need confirmation of the neoplastic process, proof that it is lymphoma, via cytology or histopathology. And you need confirmation of BLV infection, via serology or PCR.
Got it. Virus presence plus tumor confirmation, EBL-related cancer.
Precisely. Because confirming lymphoma alone doesn't rule out SBL. And confirming BLV alone doesn't mean the animal has cancer yet. You need both to connect the dots for EBL. It's essential for making the right herd management decisions.
Okay, that diagnostic clarity is vital. But then we hit this wall. Our sources are clear. There's currently no effective cure. Not for the BLV infection, not for the lymphosarcoma it causes.
That is the sobering reality, yes.
Yeah.
There's no treatment that cures the underlying infection or reliably resolves the cancer.
So what happens to animals diagnosed with the actual lymphoma?
Typically, they are culled from the herd or humanely euthanized. It's often the only option to prevent further suffering, given the lack of effective therapies.
Which again puts all the focus back on prevention and control.
Absolutely. Since we can't treat it effectively, everything shifts to stopping it from spreading in the first place.
Are there large-scale programs for this, like trying to eradicate EBL?
There have been, yes. Some countries, particularly in Europe, have had successful eradication programs. They usually rely on strategies like test and cull, identifying infected animals and removing them, or sometimes test and segregate, keeping positive and negative animals completely separate.
Does that work everywhere? Is it feasible?
It depends heavily on the starting point. In a herd or region where prevalence is already very high, like,
Mm.
80 or 90%, testing cull just isn't economically viable. You
Oh.
can't remove that many animals.
Right.
So in those situations, it requires more nuanced, long-term, integrated approaches. It's not a quick fix.
So for a farmer dealing with this, what are the absolute must-dos? The cornerstones of control?
Biosecurity, biosecurity, biosecurity. It's the bedrock, especially since we don't have a vaccine or cure. It's all about stopping those infected lymphocytes from moving around.
We talked about needling and instruments.
Yes, preventing iatrogenic transmission is huge. Single-use needles, always. Meticulous cleaning and disinfection of anything that gets contaminated with blood between animals, tattooers, taggers, hoof knives, castration tools, even rectal palpation sleeves. Every single time.
Details matter.
Immensely. Even choosing how you do procedures matters, like using electric dehorners instead of saws or gouges if possible because they cause less bleeding and are easier to clean thoroughly. It's about breaking every possible chain of transmission.
And for the vertical spread, mother to calf via colostrum.
Right. The recommendations are use colostrum only from BLV-negative cows if you can identify them, or use frozen colostrum, as freezing helps kill the virus but saves the antibodies.
Okay.
Also, basic hygiene in the calving area is important. Clean maternity pens thoroughly, remove calves from positive dams immediately after birth, and raise them separately until you know their status.
And just general herd management, keeping it out.
Yep. Maintain a closed herd if possible. Don't click in new animals often. If you do buy animals, test them rigorously. Test on arrival, then retest maybe 45 to 90 days later to catch any that were incubating the virus.
That incubation period is key.
It is. And if you have both positive and negative animals, keep them strictly separate. Different pastures, different handling equipment if possible, and use artificial insemination AI instead of natural service with bulls, as bulls can potentially transmit the virus too.
It sounds like a lot of meticulous work, constantly.
It is. But because human actions are such big drivers of spread, meticulous adherence to these biosecurity steps is truly fundamental. It's not just best practice. It's the primary defense against BLV.
Sure.
Seemingly small steps have a massive cumulative impact.
Okay. Biosecurity is key, but it feels like a gap. No vaccine. With all these challenges, is anything happening on the vaccine front for BLV?
That's the million-dollar question, isn't it? And unfortunately, the answer right now is no. There is no commercially available vaccine for bovine leukemia virus.
Still nothing. Wow.
It represents a really critical unmet need in controlling this disease. But research is definitely ongoing. People are working hard on it.
What kind of approaches are they trying?
Various angles. There's research into live attenuated vaccines using a weakened form of the virus. Some studies show promise there in reducing how severe the disease gets.
Okay.
Others are working on subunit vaccines, using genetic engineering, recombinant DNA tech, to produce specific viral proteins, things like GP51, GP30 that the immune system can react to.
More targeted.
Right? There are also inactivated or killed virus vaccines, synthetic peptide vaccines, even DNA vaccines being explored. But so far, many have struggled with providing strong, long-lasting protection or completely preventing infection.
Why is it so hard to make a vaccine for this one?
Well, retroviruses are tricky beasts because BLV integrates itself into the host's DNA, getting an immune response that can effectively clear that is challenging. Eliciting that robust, durable immunity is the main hurdle.
So the research continues, but it's a tough nut to crack.
Absolutely essential research, though. A breakthrough vaccine would be a complete game changer for managing BLV globally. We just aren't there yet.
And then circling back quickly to sporadic bovine leukosis, SBLL. If there's no known cause, no virus to target, what can be done? Control must be incredibly limited.
It is extremely limited, unfortunately. Since we don't know the etiology, prevention isn't really possible. The focus has to be on early detection of affected animals.
And
then usually humane culling or euthanasia, primarily for animal welfare reasons, to prevent suffering, and also just to remove them from the herd in case there is some unknown infectious component.
some more research needed there, too.
Definitely.
Yeah.
There's a critical need for more research to figure out what causes SBL. Until we understand the why, developing effective prevention or control strategies is pretty much impossible. It remains a frustrating mystery.
Okay, so let's try and pull this all together. We've taken a deep dive into bovine lymphoma today. We've seen the two main faces. EBL, driven by that sneaky bovine leukemia virus, super widespread but often hidden. And SBL, the sporadic forms, much rarer, cause unknown but often severe when they hit.
Right. And we highlighted that huge economic cost,
Yeah.
especially from the subclinical EBL, the stuff you don't see, billions lost through lower production and cows not lasting as long.
Diagnosis, we learned, is complex. It needs that multi-pronged approach for EBL, confirming the virus and confirming the cancer, not just one or the other.
And the tough reality, no cure, no effective treatment for the infection or the resulting lymphoma, which puts immense pressure on prevention.
Absolutely. Making strict biosecurity the absolute #1 tool. Meticulous attention to needles, instruments, colostrum management, herd separation. It's all crucial.
It really is the main line of defense right now.
And while there's no BLV vaccine yet, there's hope, right? Ongoing research is actively looking for that breakthrough.
Definitely hope. Continued research is vital and might eventually give us powerful new tools to control this silent thief.
So what does this all mean for you, listening? How does a disease like bovine leukosis, often silent, often hidden, challenge how we normally think about herd health?
Yeah, it really highlights those unseen impacts, doesn't it? The economic drain, the quiet compromises on animal welfare that ripple through the whole livestock industry.
It's a stark reminder, maybe, that the biggest threats aren't always the most obvious ones. Sometimes you have to look much deeper.
Well said.
We really hope this deep dive has shed some light on what's clearly a complex, important, and often hidden issue in animal health. Keep exploring, keep asking questions, and, keep digging deeper into the topics that capture your interest.